everybody, Dr. Daniel. Today I'm talking about, does allodynia occur with migraine? Allodynia is a Greek term. The allo part means other, and odun, O-D-U-N-E, the dynia part means pain. So together allodynia means pain. It's a special kind of pain that occurs with things like fibromyalgia, and occurs in the late stages of migraine headache, like a second or third day of a migraine headache, or in patients who have chronic medication abuse headache and chronic migraine, where they have a lot of headaches every day. And these patients have this experience that just touching their head or neck area is painful. So I refer to allodynia as being like sunburn. If I go out in the sun and get sunburn on my arm, normally it doesn't hurt to touch my arm, but if it gets sunburned, just to touch my arm is painful. And that's what allodynia is like for the migraine sufferer. Touch the head is painful. So simply said, allodynia with migraine is touching or stroking the head that's associated with painful condition with an individual migraine, or occurs in persons who've had chronic migraine or medication abuse headache more frequently. Allodynia is confusing to migraine patients because they really don't know where the pain is coming from. It's different from the migraine headache pain, which may be sharp or throbbing or very painful and intense. This is a low-level pain, but still painful and disabling and limiting feature that occurs just with touching the head or the neck, or that's the area. So I'll have a list that I'm going to read for you if you'll listen on causes of allodynia. It can come from touch or light pressure from a belt or like a bra strap, mechanical allodynia from motion across the skin or from light massage or for touching fabric, thermal allodynia from using hot or cold stimuli, combing, washing, or brushing the hair, putting your hair back like in a ponytail, shaving, showering, wearing contact lenses or glasses, wearing necklaces, earrings, or tight clothes, bathing or showering and water hits your face, resting your head on a pillow, or especially like lying down on the right side when your migraine is on the right side of your head and your head hits the pillow. It's painful to touch the pillow like that. A migraine comes in a certain part of the migraine event, and migraine has a timing cycle with 4 cycles, and so those are, number 1 is a trigeminal activation, trigeminal nerve and sensory nerve. It carries pain fibers to the head, neck, and scalp area. Number 2 is neurochemical release. And during that time, inflammatory neurochemicals are released, and those are neurokinin A, substance P, and CGRP, which is a complex protein. These come out about 2 hours into the migraine. If you took a triptan at that point, if you took it early on in the headache history, if you took a triptan early before the headache gets going, you can block the release of these neurochemicals, stage 2. Then stage 3 of the migraine cycle is vasodilatation of cerebral arteries, and stage 4 is the inflammation turns on and inflames the thalamus, which is deep in the center of the brain. So the thalamus is a deep nucleus in the center of the brain. It's also called the pain center. And when that part of the brain is inflamed and irritated, that's when the severe part of the headache comes. And allodynia comes at that point at what's called central sensitization. So patients who have long migraines, usually migraines that can last 4 to 72 hours according to the International Classification of Headache. So a headache can be 4 hours or 3 days. If they have a headache on the 2nd or 3rd day, that's usually the time when you're getting allodynia, because it's the late phase of this chemical inflammation of the brain. Again, if you took a triptan early on, it'll block the whole thing, so the headache can just last like 2 hours and then it's gone. So how do you get rid of allodynia? How does it clear? Well, with the example of a simple migraine attack, these chemicals are in the brain and they come down the jugular vein, they go to the liver where they're metabolized, and they go out in the toilet, and they're gone by past stage 4, or about the 4th day of a migraine headache. So someone with a single attack of migraine may have allodynia lasting a couple of days, usually at the end of the migraine, maybe the day after. That's a sore head you have the day after the migraine is gone. But persons who overtreat and get into medication-induced headache, which used to be called a rebound headache, those persons can have allodynia very frequently, or almost all the time, because the headaches are occurring so frequently. So the International Classification of Headaches says an episodic migraine is less than 15 migraines a month, and chronic migraine is 15 or more headaches a month, 8 of which have migraine features. And the migraine features we're talking about there are severe headaches, headaches that come that are one-sided, throbbing, associated with sensitivity to light and sound, and nausea and vomiting. So if a headache has those features, that can be considered a migraine. For the medication-induced headache patients or chronic migraine patients, they need to be educated about overtreating with caffeine, analgesics, NSAIDs like Advil, taking opiate narcotics. Nobody should take over narcotics for migraine, or butalbital, which is a terrible drug causing medication-induced headache. And I have blog articles and podcasts on those subjects elsewhere. So once you are detoxed off these chemicals as treatment of medication-induced headache, then the headache will clear and the allodynia will go away finally. So if it's helpful to you, understand this complicated subject, explains the sore head that migraine patients have at times, please click on like and subscribe down there so we can follow each other. God bless all you people who have migraine. And I'll see you again on the next video cast.